Most Filipinos think the worst of the pandemic is over. Social weather stations surveys in December 2021 and April 2022 found that 80% or more of survey respondents chose lumipas na ang pinakamalala over mas lalala pa ito. What do the numbers from 3 years of COVID tracking really say? Is it possible that the pandemic is or was even worse than we thought? Good evening. I'm John Nery, and you are in the public square. The vaccination program has succeeded in fully vaccinating about 95% of the target population and about 80% of the target population of senior citizens. Surely that is good news. But there is bad news too. Over 65,000 people died because of COVID-19. Some 40,000 of the dead were 60 years old or older. I've been digging around in the data and I found some worrying things. I'm happy that tonight we are joined by Professor Peter Cayton, the stats guy. He can help make sense of things. Dr. Cayton is an associate professor of statistics at the University of the Philippines in Diliman, with a PhD in statistics from the Australian National University. He specializes in, among others, forecasting analytics, econometrics, and extreme values. Welcome, Professor Peter, and thank you for joining us in the public square.
Thank you for having me, Sir John, and thank you for giving me the opportunity to talk about the COVID-19 statistics that we have right now.
Thank you. Let me begin by saying, I invited you before, but this is the first time you're able to accept the invite. What were the statistical odds that you could make it today?
I think with right now the UP Diliman is having its examinations, and I'm just going to be waiting for my students to submit their exercises. So that's why I have now a good amount of time before I start my own Czech Republic. Yes.
All right. First things first, where is the data on COVID-19? Is there a central repository of COVID-19 related statistics?
So right now, the Department of Health is making available the data at the DOH data drop. It is a publicly available data warehouse on the information about testing, about the different cases, so the case information data set, and also with regards to the situation in the hospitals. Besides that, the DOH is also making available the dashboard on the case information, like the total counts of cases, recoveries, deaths, and current active cases. And you can select which area of concern you would like to have. So, for example, Quezon City, Cebu City, Davao City, or some other municipality or province in the country. And we also have the vaccination dashboard. So we have information about the vaccination situation. Besides that, also in the COVID-19 dashboard, there's the information about the test positivity rates, and also with the situation in the hospitals. Now, something that has happened recently, like January 15, 2022, so sometime last year, the DOH has started to release data with a week of delay. So, for example, for us looking at the data independently, if you would like to have access to what is publicly available right now, the date of reference for the data that's available is at the as of December 31, 2022. So talagang year end. But this is accessible to you up until next Saturday. This coming Saturday, it would be for January 7 naman. So there's going to be this delay in how the DOH releases data, and they're saying that this is for data quality concerns.
Some issues about the COVID-19 data have been raised almost from the start, from 3 years ago. What are the most important issues, and do they affect the credibility of the DOH data?
So right now, what we're seeing is there's still a lot of these variables that are missing in terms of the DOH data.
Mhm.
A big example is when did the cases recover if they said they
Okay.
recovered.
Okay.
Yun yung missing doon.
Mhm.
Um, there is still the date of death, pero meron pa ba yung date of death? Parang nahihirapan na din kami kasing mag-verify na din ng death recently.
Mhm.
And there's still inconsistencies in the dates of epidemiological events. When we say epidemiological events,
Mhm.
kailan nagkaroon ng sintomas, kailan
Mhm.
nagpa-test, kailan
Mhm.
na-verify yung test, at kailan na-confirm. Yung pinaka kumpleto ay yung kung kailan na-confirm. Kasi pag na-confirm na siya, part na siya
Mhm.
ng pero vague pa rin yung information for a lot of cases kung kailan sila nagkaroon ng sintomas, yung first onset of symptoms. And sometimes there are some questionable discrepancies, like for example,
Mhm.
na-test siya ng August pero yung kanyang onset of symptoms ay January 1. So parang ang laking
Mhm.
gap. And
Yeah.
more like this would be something happening with the data management system inside the COVID-19 information system. And
But this is
there
not
are, sige, sige.
this is not the responsibility of DOH alone. Like for instance, you're talking about travelers. That data points would be managed by, for instance, the airport authorities. And then, how does this work? I mean, DOH does not generate all the data.
So in these situations, as we understand coming from the public statements of the DOH, there are also
Mhm.
cooperation with other institutions, like for
Mhm.
example, the Department of Information and Communication Technology, DICT, kasi sila yung, di ba, mabigat sa pag-handle ng
Mhm.
information and communication technology. So there's a partnership in that. Um, there has been certain harmonization events or harmonization
Mhm.
occurrences of DOH and PSA
Mhm.
para medyo mag-match pero hindi perfect minsan yung matching in terms of the monitoring and the data that the PSA has, which is coming from death certificates.
Mhm.
So there's also that problem that we have on that. And there are also numerous organizations that the DOH is working with. In some point in time, it worked with private partners as well. And also,
Mhm.
based on what you can get coming from the DOH, there are also some support coming from the United Nations Development Program and other
Mhm.
institutions.
Let's look at deaths. No? There's nothing quite as final as dying. As of today, January 11, the total number of COVID-related deaths is 65,509. But that's a Department of Health statistic. You mentioned PSA, the authority. It's literally in their name when it comes to Philippine statistics. Uh, they have a different tally, number of deaths traceable to COVID. Why are they different? You already mentioned one thing. PSA death data comes from the death certificates. Uh, the DOH data comes from surveillance. Can you explain the difference and how it's possible to reconcile their numbers?
So this is going to be a difficult situation kasi they're looking at two different sources of data. No, the DOH is relying on its monitoring of COVID-19 cases,
Mhm.
and the PSA is looking at the death certificate reports. Now,
Mhm.
in the PSA, they're looking at both COVID-19 virus identified, which is
Mhm.
a formal way of saying that the COVID-19 death has a confirmed test. Now,
Mhm.
this confirmed test can be rapid antigen test or
Mhm.
the RT-PCR.
Mhm.
And then virus not identified is there's no formal test of COVID, but based on the judgment of the medical doctor handling the case, based on reviewing the different
Mhm.
symptoms and also the different alternative tests that
Mhm.
can be done, like for example chest X-rays or of the sort. it could be a suspected or probable COVID-19 deaths, pero it's not confirmed COVID-19 deaths. Now,
Mhm.
you can also get that suspected or probable COVID-19 death if you have a contact to a confirmed COVID-19 case and you suffer the
Mhm.
symptoms and then you die, but you're not able to access the test. Now, even with the virus identified numbers coming from the Philippine Statistics Authority,
Mhm.
from 2020, the start of the pandemic, up to August 22 preliminary,
Mhm.
which means it could still increase. Um, the total is 92,287.
Mhm.
Now, as you have said earlier, as of now, the DOH is only saying uh, that
65.
there's 65,503 deaths. Now, why would there be this discrepancy?
Mhm.
A lot of factors, a lot of reasons. Una, there is documented delay in the confirming of a COVID-19 death.
Okay.
Um, Based on what we have seen in the data in the past, it's typically a 20-day delay. It could
Mhm.
be shorter, but it could grossly be longer from confirmation to death
Okay.
of a COVID-19 case. Sometimes, na-confirm pero namatay na pala before confirmation because those things do happen.
Mhm. Yeah.
Pero the idea is there is that delay. The second thing is hindi pa rin ah, hindi pa rin malinaw kung binibilang pa rin ba ng DOH yung rapid antigen test results dun sa
Mhm.
COVID-19 case counts nila. Ang pinakaklaro coming from the COVID-19 dashboard ay nakadepende sila sa RT-PCR.
Mhm.
So, hindi pa rin klaro kung nagagamit yung rapid antigen test or hindi pa rin consistent sa
Mhm.
iba't ibang lugar sa Pilipinas kung sinasama pa rin yung bilang ng mga nako-confirm based on rapid antigen test. So, yun yun. Now, posible bang may bad actor dun sa mga nagsusulat ng death certificate? Well, we're not
Mhm.
going to remove that instance, but note that these are also municipal records, so they're more likely to be linked to the monitoring of the
Mhm.
municipalities and cities, because as we have also documented in the past when where there's much more activity in monitoring COVID-19,
Mhm.
much more monitoring where there's the contact tracing and everything coming from the local governments, minsan mas may discrepancy yung nare-report ng local government unit from what is being reported by the DOH, and this has been acknowledged in the past by DOH na talagang may delay sila. Talagang may discrepancy in terms of how they would be monitoring the data, monitoring the situation on the ground. Kasi mas nasa ground, nasa grassroots kasi yung LGU as
I
compared dun sa DOH.
I
Pero
wanted to
ngayon
ask you.
kasi bumaba na yung
I
activity
wanted
ng
to ask
LGU.
you if there are also issues with PSA data. So you mentioned one already. Um, but really, my uh, background question is the does this affect the credibility of PSA data?
Now, that is something that is very difficult to confirm kasi on the ground
Mhm.
Um, I'm not going to be accusing PSA of any
Mhm.
wrongdoing here because there is still going to be those data quality concerns naman. And
Mhm.
note that these death certificates are legal documents.
Yeah.
uh, and they have to be processed in a manner of through a due process.
Mhm.
Um, and this facilitates investigation by the medical legal or any professional that can handle the death certificate. Um, I've had uh, we've had a way of having to record with the death certificate yung talagang investigation na may contact tracing in the past
Mhm.
when we had a local death here in our family. So, naiintindihan ko yung proseso pagtama yung ginagawa in terms of really recording the
Mhm.
deaths through the death
Mhm.
certificate. Medyo may mga naririnig na anecdotes pero I cannot confirm anecdotes on
Mhm.
that regard. Um, So for me, what I do see here is the PSA has, at the very least, yung virus identified.
Mhm,
You can see that as a little bit credible, but I'm not
mhm,
going to be disputing na hindi credible yung DOH. It's just that there
mhm.
is a possibility of delays and there are certain concerns din naman in terms of how they could confirm the deaths.
But these issues, either with PSA data or with DOH data, do not prevent us from using the data that they provide, right? I mean, there must be a reasonable way to handle the data that's coming out from DOH and PSA.
So in the situation, DOH gives a much more finer detail of data in
Mhm,
terms of making it accessible at least on a weekly basis, and you can still find the cases per day that is confirmed by DOH monitoring. There is a some difficulty with handling the PSA data because these are already cumulative. You cannot really go on a day by day basis, and there's a very long delay in terms of how the PSA would update this. So may pros and cons yung dalawang data. Yung data from PSA is coming from the death certificates, but it's going to take a long while to process these death certificates because when the PSA processes these death certificates, hindi lang naman COVID yung tinitignan nila. They're looking at other possible causes
mhm.
of death in the country. With DOH monitoring, mas fine-tuned pero we have to expect that there are some delays, and also mayroon din tayong situation na we're not as active as monitoring COVID, like for example, contact tracing as similar to before. Or testing, hindi na tayo nagte-test as frequent as we would have had before. Especially with right now na nagsimula tayong magbukas ng ekonomiya.
Let's continue comparing the data on deaths. The You said PSA looks at two types of COVID-related deaths, right? Virus identified and virus not identified. So even just looking at virus identified, that's already, as you said, over 3 years, something like 92,000 compared to the 65,000 of the UH. If you were to include the virus not identified, we're looking at well over 100,000. Uh, First follow-up question: how credible is the virus not identified data?
Now, in that aspect, because there was not really testing done, we are
Mhm,
going to be relying on the medical legal or with the um, medical personnel that is handling the situation. It's more likely a doctor who's able to make that judgment call. Um, I do believe that the experience of the doctors that we have had handling the COVID
mhm,
19 crisis,
mhm.
they're very much trained in terms of seeing the signs.
Yeah.
There is a possibility that they can make some uh, misdiagnosis, pero we have a very strong faith that based on their experience on handling the pandemic, we do believe that they could make that proper call, especially looking at the signs of what is happening with the patient, looking at x-rays or looking at some other means of verifying that the case has been a COVID-19 uh, probable or suspected case. And there is an algorithm that the DOH is using in
Mhm.
these aspects to say that a case is suspected or probable COVID.
But what we're dealing with here, no, the numbers and then also the data from the higher number of deaths from PSA suggests that COVID was actually worse than what we already thought. I mean, would you agree with that? Is that a reasonable interpretation, at least in terms of deaths?
It is within reasonable doubt that we can say that COVID is really is worse than we what we are seeing, especially that we are not really able to monitor as much as well DOH is not able to really monitor as much as it could. It's doing its best, but
Mhm.
there are certain limitations as well, and there are certain inconsistencies in the monitoring. And in what we're seeing right now, diba, 92,000 virus identified deaths
Mhm.
from
Mhm.
2020 to August 2022. Yung
Mhm.
virus not identified from the same period is
Mhm.
56,396. So if you look at this, the Philippines had a total of 148,683 deaths of from COVID, whether it is
Mhm.
confirmed of the virus being present or it's a suspected or probable case of
Mhm.
COVID. And in other countries, they do count suspected and probable cases. It's in the Philippines, although, similar
Mhm.
to some other countries that we only count confirmed. So it is possible that COVID-19 is worse than than how we see it really, especially that um, there has been a possible increase and there's increase in mobility
Mhm.
within the population, and that we have still some problems in monitoring, and that we have a lack of monitoring as compared to what we have had in the past.
This is one of the things that I'm concerned about, no? That the relative success of the vaccination program will tend to make us forget that we went through a really terrible patch. And in fact, that the patch that we went through was even worse than we had thought. I mean, imagine if the PSA data, were proven through 148,000 deaths in 3 years, in less 4 months. That's I mean, that's a real tragedy.
So, um, yung nakikita natin sa ibang bansa, yung typical average of COVID-19 fatality is about 1%. Sa Philippines,
Yeah,
it's 1.6%, di ba?
yeah.
Now,
Mm-hmm.
kung yung 92,000 deaths, yun yung basihan nung 1% natin dito sa Pilipinas, if ever that would be the
Mm-hmm.
case, then
Mm-hmm.
there could have been 9 million cases of COVID,
Cases.
of which
Yeah.
a lot of it is not detected, more than half. Now, kung
Mm-hmm.
yung 1.6% yung magiging batayan natin, it
Mm-hmm.
is going to be equal to, by 1.6%, yun yung sa Philippines, yun yung talagang ating COVID-19 fatality rate. uh, it is possible that we have crossed 5 million already. If we're going to use 1.6% yung ating
Yeah.
Philippine. If we're going to
Mm-hmm.
use the global fatality rate, we could have had 9 million cases, and a lot of them are not detected because we have had some lack of monitoring na sa ngayon hindi na natin nasunod. For much of 2022, there has been a reduction of monitoring capabilities. Now, kung yung 148,000 deaths pa yung magiging basihan ng fatalities,
Mm-hmm.
then there could have been as much as 14 million cases of COVID or thereabouts. Kasi ganun karami yung namatay sa atin. And if we assume that COVID would be having 1% fatality rate, then what we're seeing from the PSA data could have been an indication that there's still more that we are not able to catch in terms of the infections. And mahirap kasi pag hindi natin nahuhuli itong mga infections in
Mm-hmm.
terms of monitoring and in terms of contact tracing, because COVID-19 is that disease na mabilis kumalat.
Mm-hmm.
So malingat lang tayo ng monitoring, there is a chance that it could be permeating in the population. So there is really that need to monitor it, besides having to practice yung minimum health standards of masking and looking out for
Mm-hmm.
ventilation and
So this
the other practices that we have had.
so this drive to continue to test is really important in the overall context. No, I was going to ask you if in the same way that there are reasonable concerns about the death toll, uh, in the DOH data, um, are there reasonable concerns also about the total number of cases?
So, yun yung problema natin ngayon na parang in our past na we have had a lot of surges, we have not
Mhm,
been very sufficient in testing,
mhm.
in taking into account yung pag-monitor, also contact tracing.
Yeah.
So, there is a possibility that there are certain cases that were not counted, and it is possible that the DOH has not been able to count the deaths or recoveries in that case. And much more problematic yung monitoring din ng deaths on that aspect. So that's why we're seeing some of these
Mhm,
discrepancies. So as of now, the testing positivity rate has gone below 5%, which is a good situation.
mhm,
Pero we have missed a lot of opportunities in the past to really properly monitor, and there is still a severe lack of um, the aspect of monitoring our testing, and also with respect to um, contact tracing, of which nawala na nga yung contact tracing for a lot of LGUs. And right now, yes, we have rapid antigen test, pero wala tayong protocol in terms of how to account yung gamit or results coming from rapid antigen unless yung tao ay magkukusa na magpa-RT-PCR afterwards. So may mga ganun din tayong sitwasyon na parang there is a possibility that we're not capturing some
mhm,
COVID-19 cases, especially if they're doing home testing. Unless na lang yung tao
mm.
ay magkusang magpatawag ng RT-PCR test, which would be understandable na more likely hindi nila gagawin kasi nga mas mahal yung RT-PCR testing.
Uh, the DOH data, okay, so 1.6% is the fatality rate. That's total deaths divided by total number of cases. Uh, Global, as you said, is 1%. Is the difference significant?
Now, with regards to fatality, there could be some contributing factors, especially with regards to the healthcare system that is inside a country. Some
Mhm,
countries have lower case fatality rate, and one good example of that would be Singapore. They have very
mhm,
low case fatality rate because they're able to accommodate the cases that they have in their healthcare
mhm,
system. The
mhm,
Philippines is at 1.6, so it's higher than the global average, and this could be accounted for with certain discrepancies in what is happening in our healthcare sector. We're not saying that our personnel are doing poorly. It's more like we don't have enough personnel, we don't
mhm,
have enough spaces during the height of the pandemic where we're having a lot of deaths. So, yun yung nangyayari na noong panahon na overcapacitated yung ating overcapacity yung ating healthcare sector, yun
mhm,
yung mga events na nagkakaroon tayo ng maraming deaths. Um, and these were like, for example, during the alpha, beta, and delta surges that we've had, yung talagang
mhm,
uh, sumasagad na yung level ng ating mga ospital, nahihirapan ng makahanap ng mga ospital, yun yung more likely nagkakaroon ng mga occurrence than deaths, yung capacity. So
mhm,
sometimes the ability of your healthcare system, your hospitals, your personnel uh, to handle the pandemic, especially in a very extreme crisis situation, those are going to be contributing to more deaths in that situation.
Another factor would be vaccination. If I'm not
Yes,
mistaken,
yes.
if I'm not mistaken, uh, the second wave, the alpha beta wave, that took the
We were
vaccination
having
wave,
vaccination, yes.
yeah, started there, and then
Mas
but the
malala
number,
yung Delta.
yeah, delta, higher number of cases, but also higher number of deaths. But in the fourth wave, the Omicron, even higher number of cases, but much lower number of deaths. My question is that reasonable? Is it reasonable to interpret that as an effect of the vaccination?
Now, in a way, we were able to have a higher rate of vaccination when Omicron came
Mm-hmm.
to the country during the Christmas time 2021 as
Mm-hmm.
compared during the Alpha, Beta, and the Delta waves. So
That's right.
there is some contribution of vaccination,
Mm-hmm.
especially if boosted. And these were situations kung saan na um, in the Alpha, Beta, and Delta surges, hindi pa tayo vaccinated, hindi pa widespread ang vaccination.
Mm-hmm.
Um, Nagkaroon talaga nga ng impact yung talagang hindi pa ganun nag-permeate yung vaccination para ma-prevent yung a lot ng mga deaths. Pero if we never vaccinated, it could have been literally a lot worse. Um,
Yeah.
but still, because of hindi natin na timingan yung yung ating pagbakuna as soon as possible, there was still a lot of questions about the vaccine. Yes, there are certain hesitancy, but it also includes yung lack of distribution. We're getting uh, the less vaccines accessible to many people. So that still contributed to the problem of vaccination and therefore leading to a lot of possible severe cases and in some cases deaths as well.
But one of the things that really struck me, that really disturbed me when I was digging through the data, was that some areas had much higher fatality rates. Cebu province, for instance, had a fatality rate of 4.8%. 4.8. Aurora province, a fatality rate of 5.1%. Is it reasonable to interpret that as well? They did not handle, excuse me, they did not handle COVID-19 as well as other provinces.
Now, with respect to Aurora, um, there is a possibility that there could be certain biases in terms of kasi konti lang naman
Mm-hmm.
relative to
Relative, yeah.
NCR
Mm-hmm.
or major population areas na yung a number of confirmed cases is relatively lower kaya
Mm-hmm.
mas na-highlight yung deaths. Now, it is also possible that there are certain monitoring problems in terms of being able to capture it. But it's also possible that the high amount of deaths relative to the size of the population or relative to the number of cases would also be with regards to access to healthcare.
Mm-hmm.
Aurora comes into mind na very limited lang yung
Mm-hmm.
healthcare capacity ng probinsya in terms of both monitoring and also handling cases.
Mm-hmm.
Especially in the past. More recently, syempre, since konti na lang yung mga kaso, mas madali nang i-handle. Pero
Mm-hmm.
syempre, during the height of the pandemic, hindi na-handle agad. Because
Okay.
kaya yung mga ganong sitwasyon. Um, with Cebu,
Cebu.
you said
Mhm.
Cebu, ano? And I
Province.
think it's going to be up province. So this for me would also be including Cebu City. Pero ang Cebu naman, pwede kasing ganun eh. Yung may iba't ibang geographic problems or geographic context that could make it difficult. Um, and if we look at, for example,
Mm-hmm.
Quezon City, it's a large city and therefore a very dense city, large population,
Mm-hmm.
very dense. It's going to be having a very large COVID-19 case and therefore also reflecting a lot of deaths. Pero if you look at the fatality rate, it's going to be
1%.
1%, diba?
Mm-hmm.
Or more recently 0.96%, so less than 1% recently.
Okay.
So um that large city with the large population, we really have a lot of deaths, but note that Quezon City has a lot of hospitals, a lot of facilities to help monitor COVID-19 cases. And being also a much more richer city,
Mm-hmm.
local governments could easily support families to, um, in terms of either healthcare or general
Mm-hmm.
care
Mm-hmm.
during a crisis in the
Mm-hmm.
situation. Though still, even at the height of the pandemic, it's not impossible for Quezon City to have a lot of deaths, a surge of fatalities because of a general surge that has happened in the country. So, pero as we see the situation, because of um, a lot of resources available to LGU, a lot of healthcare facilities available, a lot of ability to monitor, mas mababa yung deaths. So there's going to be these variations, and these variations, these
Mhm.
differences between areas are because of what are on those areas and the ability of those areas to adapt to the crisis.
But if you were president of the Philippines and looking at these two cases, I'm glad you brought up Quezon City, no? And you want to have a more effective pandemic response in the future, what would what policy would you put in place? So, Quezon City has about 2,600 deaths after 3 years. Cebu Province about 2,500. So more or less about the same. But Quezon City had 5 times the number of cases. I forget the number now, but something like 250,000 plus. 5 times the number of cases that Cebu Province had, about 50,000. Um, if he had the power, what kind of public health policy should be put in place?
So
Numbers.
I am a statistician,
I know. I'm
so it's
sorry.
best that so it would be best handled by those who have really a background on public health, these
Mhm,
things. And generally, what I would hear from peers that are working in public health is we really should be investing in the healthcare system. Pero hindi lang
mhm,
basta-bastang ospital lang. Kasi hindi naman sa lagi-lagi ospital ang unang pupuntahan ng ano, and hindi rin naman natin gusto na ospital ang unang pupuntahan kasi magpupunuan kung gayon. Especially hindi rin naman kaya ng maraming LGU na parang may hospital sila sa kanilang lokasyon. And more likely, it would be best if there is really an understanding of how our public health professionals and medical doctors are interacting with grassroots communities kasi. These are best given into context by those who are working in public health. Pero kung iisipin mo, kung tayo, saan ba natin gustong unang pumunta pag tayo ay may nararamdaman? More likely, uunahan natin pumunta yung health center, hindi laging ospital eh. It's all going to be
mhm,
this first line
mhm,
of contact, yung ating healthcare center or yung ating mga local clinic. So, ang mas maganda talagang unahin is yung paganda ng primary care, 'di ba? Yung unang punta, yung para ma-accommodate yung sitwasyon ng tao at kung paano nila i-handle yung sitwasyon. 'Pag severe yung kaso o critical yung kaso saka ipupunta to a hospital, which is in fact ang tawag nila sa medical sector sa hospital ay tertiary care. So
mhm.
hindi siya yung primary point of contact. Lagi yung first point of contact would be yung local level, if is more likely healthcare center or ano. At dapat yun yung palakasin. Though best, these are some things that I would hear from public health peers, and best that these should be known with these are best handled or managed by public health peers.
I wonder if it's possible for statisticians to work with public health specialists to, for instance, formulate, let's say, something like a preventable deaths metric, uh, as a way to hold the people in official positions accountable for the deaths that happen in their localities.
Now,
Um,
okay, about that, there have been a lot of work, especially those or statisticians or healthcare professionals who have specialized training as statisticians or biostatisticians or those that are interacting with public health professionals. And I have interacted with a lot of public health peers to
mhm,
look into these kinds of different metrics.
mhm,
And there are these existing ways of which you can have statisticians, mathematicians, data
mhm,
scientists working with public health professionals and medical doctors in terms of having those kinds of metrics. Um, I do remember some work with colleagues of which we look at COVID-19 risk.
Mhm.
So yung parang the ability to handle the risk in terms of vulnerability, uh, vulnerability hazard, and all of these other aspects. So it's not impossible that statisticians, data scientists could work with public health professionals. And in fact, there is a growing field of data science that we call health informatics that uh, hopes to really go forward with that sort of thing. And as more and more people get interested in how statistics, data science works with health,
Mhm.
um, we do hope that these kinds of technologies in data would enrich then yung ating monitoring of uh, other health diseases, including COVID naman.
Professor Peter, I didn't realize we're running long pala. Sorry, I really found this very, very interesting, this discussion. Let me just ask a few more, maybe two or three more questions about vaccination. Uh, I'll try to be quick. So first, uh, do you have issues? Are there issues with the vaccination statistics, or are they credible?
It's very difficult to assess kung sila ay credible because sometimes there have been delays on how it gets updated.
Mhm.
But that was the issue that we saw last year. I'm looking at the dashboard right now, and it is
Mhm.
updated to January 10.
Mhm.
Um, with what we're seeing in the past, when especially included yung information sa Vaxxert PH, these could be good in terms of updating, pero hindi na natin alam kung na-update pa ba yung counts. Hopefully, we are seeing that it is getting updated, and I'm seeing right now that there were 15,000 doses administered. Pero siguro, looking at these data, siguro yung isang malaking problema na lang na nakikita natin is konti pa rin yung nagbo-booster sa Pilipinas.
Yeah.
And that is a problem, especially with variants. And there has been some documentation that at some point, uh, at least 6 months, in some cases, na medyo nagiging more susceptible ulit. Pero still, vaccinating reduces severe manifestations of COVID. Pero it the immunity sometimes wanes. There's a chance that it would wane for certain people, so it's great to be boosted. And especially for those immunocompromised, it's best to be boosted. Better if you can do it twice.
So the vaccination statistics of the DOH record 165 million doses, no, have been administered. That's also reflected in the COVAX facility site, 165 million. But there's the FDA website, the Food and Drug Administration website, contains a regular report on adverse reaction, and table two is always about um, a breakdown of vaccination per brand. And the total there is 168 million. So even there's a discrepancy between FDA and DOH.
That one.
How do,
Okay.
how do you resolve that?
Now
What
this is something that um this is something that has to be dealt with between FDA and the DOH in terms of how between the FDA and
Mhm.
the other monitoring institutions within DOH, because I remember FDA is part of DOH, and that kind of is going to be needing some internal review
Yeah,
of
and the data comes from NBOC,
yes,
which
yes,
which is DOH. In fact, it says
yes,
there,
yes.
data from, but the total difference. Uh, I'm just, we need to get our act together. sayang din.
It is something we really need to get our act together in terms of these data. I do admit that. Um, uh, it is how DOH should be handling it within itself kasi internal to, di ba?
Mhm.
Wala namang nailalabas na ibang wala namang ah, mangyayari except within themselves. So that is something that
Mhm.
within DOH should be monitoring. It is something na kailangan ngang malinis yung paano yung data responsibility on that matter.
Last question, Professor Peter. Um, Given all our concerns, and also the different ways we use the data that we have concerns about, how should the public perceive and respond to COVID-19 statistics? What's a
So
reasonable citizen to do?
so in terms of how the public should respond with COVID-19
Mhm.
pandemic, it is always best to practice these public health standards, knowing that we don't really know the exact numbers and we still have to interact with different age groups in our families or in our communities. It is really best that uh, to maintain that security through practicing masking and certain hygiene practices, and also with regards to um, masking, and also at least having some concern in terms of the ventilation or filtration of air that is happening in the different businesses and offices that we have uh, across the country. So um, it is still important for us to be more vigilant in terms of taking care of ourselves, and also vigilant on calling for safer communities, safer in terms of pandemics, and also in terms of pandemic prevention, and also in terms of um, really having that security in the community of preventing illnesses, di ba? There's still also going to be calls to have more boost, to have more of the population to be boosted as well. If you are still not boosted, but are qualified to be boosted, please get boosted. So those are the things that we should be looking out for as members of the public.
Dr. Peter Cayton, Associate Professor at the University of the Philippines, also known as the Stats Guy. Thank you. The clarity you bring to the discussion is a gift. What a pleasure it was to join you in conversation. Again, many thanks.
Thank you for the opportunity as well, Sir John and to Rappler.
Well, that's it for us tonight. The next step for engaged citizens is always to take a more active part in rebuilding our democracy. See you in the public square. This is John Nery. Thank you and good night.